Okay. Chapter 8, nursing process planning. Okay. Planning is the third step of the nursing process. During the planning phase, the professional nurse prioritizes the patient's nursing diagnosis, determines short and long-term goals, identifies outcome indicators, and lists nursing interventions for patient-centered care. Each of these actions requires careful consideration of assessment data and a thorough understanding of the relationship among nursing diagnoses, goals, and evidence-based interventions. The planning process. Critical decisions regarding the patient are made during the planning step of the nursing process. To begin planning, the nurse prioritizes each nursing diagnosis that is identified and establishes goals in collaboration with the patient. The nurse identifies the most urgent goal to be addressed, considers the patient's capabilities, and then selects interventions to include the patient's individualized plan of care. The order in which nursing diagnoses are addressed depends on factors such as the severity of symptoms and the patient's preference. For example, a patient's ability to breathe is of greater concern than the ability to complete activities of daily living independently. After emergent needs are met, less critical needs are addressed. The nurse's ability to prioritize patient needs expressed through nursing diagnoses is essential for establishing realistic outcome criteria and interventions to help meet them. Goals are set for short and long-term attainment. Patients should be included in the planning process. Involving patients in planning their care helps them, 1, be aware of identified needs, 2, accepting realistic, measurable goals, and 3, embrace interventions to achieve the mutual agreement. 3, embrace interventions to achieve the mutually agreed on goals. Inclusion of patients in the planning process tends to improve goal attainment and patient cooperation with interventions. By accepting guidance and input from patients during the planning process, the nurse provides them with a greater sense of empowerment and control. A large portion of the success in progress toward achieving the goals remains within the patient's power. Depending on the patient's condition or circumstances, it may be advantageous to include members of the patient's support system, i.e. family, friends, and caregivers, in the planning phase. Including patients and their families enhances their understanding of identified needs and decreases their sense of ownership in working toward the established goals. The professional nurse is instrumental in communicating and teaching the steps necessary for patient improvement. It is imperative for the patient to understand the plan of care and be an active participant in the nursing interventions. Prioritizing care. Setting priorities among identified nursing diagnoses is the first step in the planning process. The nurse is responsible for monitoring patient responses, making decisions, culminating in a plan of care, and implementing interventions, including interdisciplinary collaboration and referral, as needed. The nurse is significantly accountable for patient achievement or desired outcomes. Providing safe and effective care to all patients is a national priority. Nurses are constantly challenged by increasing patient comorbidities, 2 or more medical conditions or disease processes occurring at the same time, and greater complexity of patient needs. Maslow's hierarchy of needs. Use of Maslow's hierarchy of needs helps organize the most urgent to less urgent needs. The framework organizes patient data according to human needs common to all individuals. Maslow's theory suggests that basic needs, such as physiologic needs, must be met before higher needs such as self-esteem. Applying this theory to the prioritization of nursing diagnoses means that a patient's nursing diagnosis of nausea is of more immediate concern than the patient's impaired socialization. Even in this case, the needs of the patient may be related. A patient experiencing nausea because of chemotherapy treatment or as a reaction to medication, may increase interactions with others after the nausea is relieved. This example underscores the interrelatedness of a patient responses to illness in life situations. Life-threatening concerns versus routine care. It is essential that the nurse identify life-threatening concerns in patient situations that need to be addressed more quickly. The ABCs of life support in the healthcare setting, airway, breathing, and circulation. I didn't know that. ABCs, airway, breathing, circulation, are a valuable tool for directing the nurse's thought process. Depending on the severity of a problem, the steps of the nursing process may be performed in a matter of seconds. For instance, if a patient is in respiratory arrest, the most critical goal is for the patient to begin breathing. In critical situations, the steps of the nursing process are performed through instant clinical reasoning by the nurse and do not involve patient input. The necessity for this type of rapid clinical judgment requires the nurse to have the ability to recognize the existence of crises, have extensive knowledge of current and best practice, and have excellent professional skills. Optimal patient safety requires nurses to acquire and continually improve their assessment and critical thinking skills. After a patient is stabilized, the nurse continues assessment to evaluate patient's updated status, determine possible causes of complications, and identify less urgent goals and interventions for care. Some situations fall between life-threatening and routine, and the patient's needs require a proportional response. For example, a patient's need for medication to relieve pain, rated 3 out of 10, is not as urgent as a patient's need for relief of pain, rated 10 out of 10. Likewise, a pain level of 10 that does not appear to affect the patient's ability to breathe is severe, but it is not as life-threatening as an ABC problem, airway, breathing, and circulation. The patient's feelings about which concerns are most important influence the ranking of nursing diagnoses in addition to clinical judgment. For situations in which no life-threatening concerns exist, goal setting for a patient-centered plan of care must take patient preferences into consideration. Conflicting priorities. Occasionally, the nurse and patient have conflicting priorities. The nurse and patient may have different beliefs and values regarding health practices. Based on prior experiences, each may reach conclusions before fully understanding the other's perspective. Patients may have difficulty accepting and making necessary lifestyle changes, finding time to exercise when a patient typically works 12 hours each day, or giving up traditional cultural foods due to medication interactions can be challenging. Identifying realistic goals that are acceptable to patients and include adherence to sound health care regimens require time and cooperation by everyone involved in the goal-setting process. Nurse-patient collaboration in the goal-setting process can help alleviate the incidence of conflicting priorities. Planning that includes patient teaching to support goal attainment and explain the importance and implementation of interventions is a core nursing responsibility. If patients do not understand what has been taught, the potential for a goal achievement is diminished. The nurse must account for individual differences in goal planning to facilitate effective teaching and positive patient outcomes. Goal development. Goals are broad statements of purpose that describe the aim of nursing care. Goals represent short and long-term objectives that are determined during the planning steps. Some sources establish time parameters for short and long-term goals, whereas others do not. According to Carpenito, goals that are achievable in less than a week are short-term goals, and goals that take weeks or months to achieve are long-term goals. A short-term goal has a morbidly obese patient patient will lose 1 pound during 1 week's hospitalization. A long-term goal for the patient might be patient will lose 50 pounds in 1 year. Useful and effective goals have certain characteristics. They are mutually acceptable to the nurse, patient, and family. They are appropriate in terms of nursing and medical diagnoses and therapy. The goals are realistic in terms of the patient's capabilities, time, energy, and resources. They are specific enough to be understood clearly by the patient and other nurses. They can be measured to facilitate evaluation. The nurse creates goals with the patient and possibly with the family by discussing the patient's current condition, the condition to which the patient wants to progress, and the actions the patient and nurse undertake to accomplish the goal. The nurse's input into this process is critical to developing reasonable goals and interventions. Without the nurse's guidance during this step, the goals and interventions may be too weak to promote the patient's success or too aggressive for the patients to achieve. The nurse works with the patient to develop a plan of care that is reasonable, is appropriately challenging, and promotes patient success for goal attainment. Goal characteristics. Goals are statements designed in collaboration with patients to provide guidance and ultimately a measure of progress when addressing nursing diagnoses, i.e. patient problems. The goals should be realistic, patient-centered, and measurable. Realistic goals. Realistic goals consider the patient's physical, mental, and spiritual condition in relation to the ability to attain goals. The nurse must consider the effects of conditions such as severe pain related to recent surgery or clinical depression or hopelessness on the ability of the patient to reach goals in a timely manner. Other barriers to goal attainment may be related to the economic issues or available resources. Some goals may be too ambitious to attain and need to be reevaluated and revised. Patient-centered goals. Patient-centered goals are written specifically for the patient. The goal should specify the activity the patient is to exhibit or demonstrate to indicate goal attainment. The activity may be the patient ambulating, eating, turning, coughing, and deep breathing, or any number of other activities. These goals are written to reflect patient, not nursing activities. Measurable goals. Measurable goals are specific, with numeric parameters or other concrete methods of judging whether the goal was met. When writing a goal statement with a patient, the nurse needs to clearly identify how achievement of the goal will be evaluated. When terms such as acceptable or normal are used in a goal statement, goal attainment is difficult to judge because they are not measurable terms unless they refer to laboratory values or diagnostic tests findings. For example, although there is a normal range for blood pressure, the patient's morning blood pressure will be between 120 and 140 millimeters Hg, I should know what that means, is systolic, and 70 and 90 Hg diastolic. Hg, I don't remember. Is preferable to blood pressure will be within the normal range. Physiologic norms vary somewhat from person to person, and sometimes depend on age and ability. The use of measurable verbs when writing goals and outcomes is essential for establishing criteria with which attainment can be evaluated. Time-limited goals. In most cases, goal statements need to include a time for evaluation. The time depends on the intervention and the patient's condition. Some goals may need to be evaluated daily or weekly, and others may be evaluated monthly. The healthcare setting affects the time of evaluation. If the goal is set during hospitalization, the goal may need to be evaluated within days, whereas a goal set for home may be evaluated weekly or monthly. At the time of the evaluation, the goal is assessed for goal attainment. The new goals are set, or a new evaluation date for the goal. The same goal may be chosen if the goal is still applicable for the patient's care plan. Outcome identification and goal attainment. Outcome identification, which was added by the American Nurses Association in 1991, is a specific aspect of the nursing process. It involves listing observable behaviors or items that indicate attainment of a goal, similar to standard language taxonomies for nursing diagnoses. There are taxonomies for nursing outcomes, including the International Classification for Nursing Practice, ICNP, and Clinical Care Classification System, CCC, and Nursing Outcome Classification, NOC. NOC is a standardized vocabulary used to describe patient outcomes. In this system, an outcome is an individual, family, or community state, behavior, or perception that is measured along a continuum, in response to nursing interventions. Outcome indicators are criteria by which goal attainment is observed and measured. Moorhead and colleagues think that the nursing profession to become a full participant in clinical evaluation, research, policy development, and interdisciplinary work. Patient outcomes influenced by nursing care must be identified and measured. Nurses play a critical role in achievement of positive outcomes and in outcome identification. An example of a measurable goal statement and an NOC indicator is provided in Table 8.2 on the next page. Care plan development. There are multiple formats in which to develop individualized care plans for patients, families, and communities. Each healthcare agency has its own form, including electronic formats to facilitate the documentation of patient goals and formulate individualized, patient-centered plans of care. All formats contain areas in which the nurse identifies key assessment data, nursing diagnoses, goals, interventions for care, and evaluation of outcomes. In most agencies and specialty units, standardized care plans that must be individualized for each patient are available to guide nurses in the planning process. These types of plans, including clinical pathways, are addressed in Chapter 9. In formulating patient care plans, the student can use the Conceptual Care Map, CCM. This tool facilitates the organization of assessment data, nursing orders, and physician orders, AE treatments, analysis of medication orders and laboratory and diagnostic testing results, and development of a plan care based on the patient's total picture. Figure 8.2 shows a partially completed CCM. It is a combination of a concept map and a care plan. This format for care development enhances the nursing student's ability to accurately collect, analyze, and synthesize patient data for identifying appropriate nursing diagnoses, goals, and interventions. It can be used to organize patient data and develop a plan of care. The patient data in the assessment area of the CCM can be organized in a variety of ways, including by a head-to-toe approach, body systems, or Gordon's functional health patterns. Types of interventions. During the planning phase of the nursing process, the nurse works with the patient, family, and other caregivers to design activities that can assist the patient in improving health and attaining goals. These activities are called interventions. The three types of interventions include independent, dependent, and collaborative. Take into consideration 5 key elements. Patient assessment findings indicating signs and symptoms that have resulted from or occurred in response to an illness or life experience. The underlying etiology or related factor identified in each nursing diagnosis. Realistic patient outcomes considering the patient's health status and resources for improvement. Evidence-based interventions aligned with the patient acceptance and practicality. Expertise of the nurses and other healthcare professionals and agencies involved in the patient's care. The nurse is primarily responsible for making decisions about which interventions are best suited to meet a patient's individual needs. There is no substitute for an extensive understanding of the nursing process, excellent skill set, knowledge of best nursing practices, and compassion for a patient's situation. Professional nursing practice guides each aspect of decision making in the planning process. Independent nursing interventions. The ability of nurses to enact independent interventions has expanded in recent years, allowing nurses to initiate care that they recognize as essential in meeting patient needs or preventing complications, ordering heel protectors for patients susceptible to skin breakdown, and initiating preventative measures, e.g., activity regimens, consultations with social workers, pre-admission teaching, are often independent nurse-initiated interventions. Methods of determining interventions to meet patient outcome goals is to use intervention taxonomies such as ICNP, CCC, or Nursing Intervention Classification, NIC. NIC is a comprehensive research-based standardized collection of interventions and associated activities. NIC provides nurses with multidisciplinary interventions linked to a nursing diagnosis and a corresponding NOC. It is useful for clinical documentation, communication of care across settings, integration of data across systems and situations, effectiveness research, productivity measurement, competency evaluation, and reimbursement, and curricular design. Each NIC includes associated activities that nurses do on behalf of patients independent and collaborative interventions and direct and indirect care. An example of an NIC with associated activities is in Table 8.3. Dependent nursing interventions. Some interventions originate from healthcare provider orders. The nurse incorporates these orders into the patient's overall care plan by associating each with the appropriate nursing diagnosis. Dependent nursing interventions include orders from oxygen administration, dietary requirements, medications, and diagnostic tests. Dependent interventions complement independent nursing interventions to address patient needs more fully. As the role of the advanced nursing As the role of the advanced practice nurse expands, nurse practitioners are becoming increasingly responsible for what were traditionally considered only patient-initiated interventions. The associated activities shown in Table 8.4 are both independent and dependent nursing interventions. Monitoring the patient's temperature and skin color are independent nursing interventions, whereas administering antipyretics is a dependent action. Collaborative interventions require cooperation among healthcare professionals and unlicensed assistive personnel, UAP. Collaborative interventions include activities such as physical therapy, home health care, personal care, spiritual counseling, medication reconciliation, and palliative or hospice care. These types of interventions require consultation with other healthcare professionals or referrals to specialists or agencies for assistance. Collaborative interventions may involve the expertise of a few or many members of the healthcare team. In the case of home or hospice care, the nurse is most often the care planner and coordinator of care among many healthcare team members before, during, and after acute care. Care planning cannot be delegated to UAP. Planning throughout patient care. Planning patient care is an ongoing process that takes place at a variety of times and in many settings. Care planning begins when a patient and nurse first interact, and it continues until the patient no longer requires care. The process of planning is similar in all circumstances, even if the setting or timing varies. Seamless communication throughout a patient's care ensures continuity of treatment and improved patient outcomes. Pre-admission teaching is a significant role for the outpatient surgery or office nurse who contacts patients before testing or surgery to educate them on pre-admission procedures and facilitate their cooperation. Through early intervention, patients learn what will happen and they are better prepared for healthcare experiences. This increased understanding aid patient as they approach diagnostic testing or surgery. Acute care community and home care nurses continually review patient data to determine the need for revised goal setting and care plans. Discharge patterns plays an important role in the success of a patient's transition to the home setting and after hospitalization. Because most patients are in the hospital for only a short time, nurses must begin discharge planning on admission and continue until a patient is dismissed. Research shows that comprehensive discharge planning reduces medication errors and readmissions. Home care planning adapts to the situation as the patient's condition improves or deteriorates due to the advancing disease. The significance of developing organized plans of care for patients cannot be stressed enough. The nurse must take seriously the responsibility of prioritizing patient needs, developing mutually agreed on goals, determining outcome criteria, and identifying interventions that can help patients achieve positive outcomes. After these actions are completed in the planning phase of the nursing process, it is time for implementation of the patient's plan of care. Whoop, whoop. Okay.